Not collecting for the work you do on your patients is the fastest way to diminishing profits, increase overhead, and ultimately lower take-home income for you, the owner. If you happen to be one of the administrative team members of the practice, and if your bonuses are tied to patient collections, then this impacts you as well. With this video, my goal is to show you why it pays to be persistent on your collections, meaning why it's so important to have your in-office team go after the patient balance that's owed to your practice on a consistent basis. Collecting what you produce is the #1 way to make sure you're getting paid for the work you do on your patients. And if you're not collecting what you're producing, you're working for free. Instead of sending patient balances over to a collection agency and have them take 50% of the money that's owed to us, it was worth having my team go after these patient accounts. And in fact, I want to tell you about 2 separate incidents/scenarios to show you why you shouldn't rush to send patient balance over to a collection agency. And it was worth having my in-office team go after those accounts. And by being persistent with your collections, you're gonna add to the bottom line without incurring additional costs. Stick around until the end because I don't just talk about the problems we ran into, but I'm also gonna discuss the changes we made so the ball isn't dropped and we don't run into problems again. For maintaining cash flow in your dental practice, you probably do most of the following to stay on top of your collections, like collecting patient copays at time of service, like when you start work on patients, or splitting patient payments up for multi-visit procedures like crown and bridge, verifying insurance benefits and attaching it to the patient's chart, offering patient financing for their convenience, and making sure you have correct procedures attached to patient appointments, as well as you're providing correct documentation for the processing of those claims. And you've allowed extra flexibility for those patients who've been with your practice for a long time and who have spent a good amount of money with you, and so on. But even after doing all of that, you still end up with patient balances. Now, these balances may be from the insurances paying less than what you expect, or maybe the patient didn't want to pay until their primary and secondary insurances paid. Maybe your team collected less than what they were supposed to, or even worse, they completely forgot to collect. Yes, it does happen. All right, so let's get into the specific scenarios that I wanted to discuss of my real patients. For the first patient, she has 2 insurances. We had pre-authorized all the work that we needed to do for her as she had requested under her primary and secondary insurance. Basically what we do is we send the pre-authorization to the primary and then to the secondary. Once we have in our hand approval from both plans stating that there will be benefits for the crowns that we needed to do, we were good to go. So by adding up whatever the primary insurance was going to pay and whatever the secondary insurance pays, as long as it equals the allowable fee for that procedure, we were good to go. And for this specific patient, we collected nothing but $100. Because we knew between both plans it would cover everything that we needed to do. As we were progressing in the treatment plan, we were generating claims for the primary, getting paid, and then sending it over to the secondary and also getting paid as we expected. Except for the fact that she ended up needing a root canal in the middle of the treatment plan unexpectedly. She was informed right away that once she saw the endodontist for the root canal, when she came back to us for the finishing of the crown, she would be maxed out under her secondary insurance and would end up having to pay out of pocket because she was going to have a balance. She understood that and still wanted us to file the claims with the insurances first. Now, as I always discuss, we always consistently stick to our policy of collecting any patient balance on the day they come in for work. But in this case, because she ended up needing the root canal, after I had already temporized the tooth, she ended up fracturing the tooth, ended up getting the root canal. We did not collect the balance at this time. And we waited for the secondary insurance EOB to come in and basically letting us know that she would be maxed out. So here's the template letter that we typically use, and we modified it for this specific patient. We printed up the copies of the primary and the secondary EOBs and highlighting the balance. We went ahead and mailed all this out to the patient and left her a voicemail letting her know of all of this. We don't hear from her at all. We send another statement out about 2 weeks later. Then she did call back one day and spoke with my treatment coordinator, letting her know that she does plan on making payments, but she did not want to make any payment over the phone that day. Now, 2 weeks later, we sent out another statement with an account past due sticker to grab attention. We then called again a few days later, and she ended up picking up the phone and actually made a partial payment of $180 towards the balance and let us know that she'll be making the rest of the payment later. Between quick texts, phone calls, and sending out physical statements, she finally ended up taking care of the full balance in February of this year, bringing her account balance to 0. Because of the consistent collection efforts by my team, and without sending this patient over to a collection agency, we were able to collect the full balance that was owed to us over time. Now, you're probably thinking, who has the time to do all that for the whole year? Actually, it wasn't a ton of work. Let me explain. The work involved was printing up the initial letter and the primary and the secondary EOBs. But we had a system in place to track when she was supposed to be followed up again and what was supposed to happen, whether it would be a phone call, a text, or mailing out a statement. This way, we didn't have to pull up the aging report from Open Dental again. It's right in front of my team member when she's in the office who is supposed to be called for patient balance that day. The time it actually takes to make the attempt, quick phone call, between dialing and leaving a voicemail, about 2 minutes. The text, since it's already templated, about less than 30 seconds. Mailing the statement, meaning printing the letter with today's date, putting a sticker on it, folding it, putting it into an envelope, stamping it, mailing it out, about 5 minutes. But all of this was part of our daily routine with the rest of the other tasks. But most importantly, we were consistently in touch with her over time. Let's talk about another scenario. Since last year, we've had some patient balances on accounts due to lost checks. 3 of these checks were from United Healthcare. When we called United Healthcare to find out whether these checks were cashed or not, they let us know that these were already cashed. But how can that be? Because in Open Dental, the claims are still showing pending status. United Healthcare actually then sent us images of these checks. And I immediately called the bank whose name was on the back of that check, which deposited the check. And I spoke with the manager, and the manager did inform us that yes, it was cashed, but they did not want to give us additional information on whose account it went into. When we have physical checks to be deposited, we always stamp the back of the checks. These checks did not have our stamp, so I knew that we did not deposit it. And the manager at the bank tell us that it was a mistake on their part because one of their employees ended up depositing this check even though it was made out to our practice. I called United Healthcare immediately, and they did tell us that we'd have to fill out some paperwork. After spending the time putting together all these documents, getting them notarized, and putting them in the mail, 3 weeks later, we called United Healthcare just to find out that they have no record of receiving anything from us. 2 weeks later, we follow up again, and we speak to a supervisor who informed us that they would escalate our request to the higher-ups. We then decided to make a follow-up call every 2 weeks after that. The only thing we found out was that our request was in processing status. At least this was better than them telling us that they don't have anything from us. Finally, 3 full months later, we end up receiving 3 checks in the mail from United Healthcare because they did decide to reprocess everything, which brought these patient account balances to 0. Again, this is something that if we didn't have a system to track which claims are pending, what's happening with each claim, when the next follow-up is supposed to be, and what's happened with each follow-up, and where all the notes are getting saved, there's no way my front desk would be going back trying to collect on these balances that are owed to us, not with all the million things that she's already overwhelmed with at the front. So we learned from these mishaps and we decided to make changes. After having gone through the situation of the dual insurances, moving forward, considering all the work that we put in, for all patients that have dual insurances, we're going to just pretend the patient does not have a secondary plan, which means we will be collecting copays at the time we start work on patients, only considering their primary insurance. And once the primary insurance pays, we send that EOB over to the secondary insurance. Whatever the secondary insurance pays will be complete credit to the patient. This way, we get paid on time, we're providing an additional service to the patient by filing paperwork for them to the secondary insurance, and we save work for our team. We save time on our end because now we don't have to track with the secondary plan how much is remaining in case there's a change in the treatment plan. If patients don't move forward because of this, I'm totally fine because I'd rather not chase for balances after. So how do we implement all of this? Since I've started my practice, we have not had an issue with dual insurances up until recently. But how do we implement this in our practice management system, specifically Open Dental? Well, this requires a little bit of an effort. If you attach both the primary and the secondary plans to patient's chart in Open Dental, it's going to show you patient copays of 0 every time they come in for work because both the plans are attached. In order to ignore the secondary plan, what you can do temporarily as the patient is coming in for work is drop the secondary plan. So now your front desk can see what the patient is supposed to pay for their copay because only the primary plan is attached. However, the problem with this method is that as the patient is progressing through the treatment plan and you're generating the primary claims and then you're generating secondary claims, you can't just drop the secondary plan if there's a claim that's in pending status because of course the patient is coming back for more work. So the way around the problem is this: keep only the primary plan attached to the patient's chart. Do all the work that's necessary in the treatment plan for the patient and only generate claims for the primary insurance. Do not attach the secondary insurance. Once all the primary claims have been paid, You then go back to all the dates the patient came in with, then you attach the secondary insurance and generate claims for each of those dates for the secondary plan. Now, whatever payments that come in from the secondary insurance will be complete credit to the patient, since the patient was already paying copays considering only their primary plan, since the secondary wasn't attached at all. Hope this makes sense. Since the recording of this video, we've already done this with few patients and we've had no resistance from patients moving forward with work. They're actually just simply happy that we're filing the paperwork for them to their secondary claims, trying to get the money back. Regarding the second scenario with the lost checks, we've decided to completely move away from paper checks. Since then, we've now enrolled with EFT Payments, which are payments from insurance companies directly into our bank account. Now, however, this has added an extra step in our process of entering insurance payments into our practice management system. We now utilize an Excel sheet to track payments that are entered via EFT from the insurance portal. The Excel sheet just tracks payments by the month when the payments are entered, for which patient, which insurance, as well as the trace number. And all of this information is then reconciled with the payments that actually end up in the bank for checks and balances. All right, moving on. Do not delay collections. What do I mean by that? An important factor when it comes to collecting on patient balances is the amount of time that has passed since the patient has had a positive account balance. When we talk about accounts receivable, the industry standard is 30, 60, 90. What this is referring to is the patient balances that are either more than 30 days old, more than 60 days old, and more than 90 days old. Keeping an eye on your AR or accounts receivable should be part of your daily, weekly, and monthly routines for your front desk team. If you're doing it consistently, most of these balances should not go past the 30 days. But in reality, most of them end up in between 30 and 60 days. But remember, older these balances get, harder it is to collect. But it doesn't mean you shouldn't go after it. The scenarios I described earlier, we were way past the 120-day period, but we were still able to collect in full without handing it over to a collection agency. Older balances are hard to collect because it's out of patient's mind. So they're not getting back to you right away. It's more work for your team because now they're doing all the follow-ups, whether it's through texts, phone calls, and sending out statements and keeping track of everything. And in some cases, the time lapse is so long that the chance of you collecting on that balance drops significantly. So it's always better to follow up with these patients immediately after they have a positive patient balance and keep following up until it's paid in full. All right, another thing to keep in mind to add to your bottom line is don't be in a rush to send patient accounts over to collection agencies so fast. We could have sent these accounts that I discussed earlier to collection agency, but we didn't. Once the patient is sent over to a collection agency, the chance of you collecting on that balance drops to something like 10%. And the collection agency, if they do collect, they're gonna take up to 50% of the money that's owed to you. By having a system to help you track your collection efforts and knowing when the next follow-up should be, you're increasing the chance of your team actually reaching the patient. So majority of the time, the actual work is tracking everything. Like what was sent, what was said on the phone, when the next follow-up is, when the next statement is to be sent, etc. When your team is busy doing gazillion things at the front, like checking patients in and out, making appointments, discussing treatment plans with patients, all of this is time consuming. How do you possibly have your team reach out for a claim they called 3 weeks ago due to a lost check? And that's just one. What about those 10 pending claims and 2 of which need further documentation for the claim to be processed? And where do you store all those notes? Let's say they need to forward this claim to somebody who's gonna give them the narrative that they need to process this claim, or maybe someone needs to appeal this claim. Unless you have a way to get your team to see the money that's owed to you or your practice on a consistent basis, the important work of collecting on these balances is just not gonna get done. And then you wonder why your collection isn't close to production, or why your take-home pay is not as much as you expected because you've been so busy producing. So take your collections seriously. Implement a system that is easy for your team to follow so they can do it consistently. By adding friction to the process, it's making it difficult for your team to collect on these AR balances. That's it for today, guys. I hope you found this helpful. Don't forget to subscribe and keep tuning in for more videos.